You've heard me say it before. If we're having thyroid problems, the part of the body that I'm most concerned about isn't the thyroid gland, it's the brain. And for a lot of people with thyroid issues, one of the most common debilitating symptoms that they develop is brain fog. Now, to be clear, brain fog isn't a medically accepted diagnosis, but if you have it, you know it. So in today's video, we are going to cover how the thyroid and brain fog are related, and we'll also talk about the parts of the brain that are most commonly impacted. Of course, if you've been enjoying my videos and you like learning about natural strategies to support your thyroid gland, make sure you give this video a thumbs up, subscribe to the channel, and ring the bell. That way you'll be notified when I post a video every single Thursday morning. My name is Dr. Bodle, and I specialize in helping women with low thyroid and Hashimoto's lose weight and improve their energy naturally. And something that's really important for us to understand is that thyroid function and thyroid hormone is connected to just about every system in the body. And something that can be a little frustrating for me and definitely for my patients is many times they'll go in and see their doctor and they'll be experiencing some sort of vague symptom, and their doctor will say something like, "Oh, well, that's not at all connected to your thyroid." But the connection between our thyroid and whatever that symptom might be isn't always well understood, and it's not always explained very well to the patient if the doctor is even aware of it. So let's start out today with talking about our thyroid and how there's a strong connection and it strongly relates to the way our brain works. So as most of you already know, thyroid hormone helps to set the metabolism for every single cell in the body. But sometimes when I explain it that way, I'm not sure if it comes across as clearly as I would hope. So the way that I think about it is not so much in terms of metabolism, but in terms of a cell's ability to do its job. So if we look at something simple like our fingernails, we have to ask ourselves, what is the job of the cells that are dividing and producing that nail cover? Well, it's hopefully creating a nail that is hard and firm, which protects the ends of our fingers. Now, if we don't have good activity at that level, then what we're going to see is instead of a nice protective nail, we're going to have splitting, peeling, ridging, and nails that are very soft. So the job of the nail, which is to be strong, is now become decreased or inefficient because we don't potentially have enough thyroid hormone that's supporting that normal growth process. Another easy way to think about cells not doing their job is just think about your own life. So if you have a job but you fall sick on a particular day and you can't go to work, that job's not going to get done. And the same sort of thing goes for our cells. If they don't have thyroid hormone, they can become sick, and when that happens, they don't do things like they normally should. They don't have the type of functionality that we would expect them to. So if we bring this all the way back to our brain and the function of neurons, we have to ask ourselves, why is the brain so heavily impacted by changes in thyroid hormone? Now, while it's true that every cell in the body has a metabolism, every cell has a job to do, and therefore it needs thyroid hormone, the parts of our body that are most metabolically active tend to be more sensitive to changes in thyroid hormone. So that includes things like our metabolism and ability to burn calories, things like our hair, skin, and nails, our digestive tract, and most specifically, our brain. Our brain has a huge demand for energy to function properly, and therefore it requires the appropriate amount of thyroid hormone. Now, just like the job of our fingernail is different than the job of neurons, the type of symptoms that someone will experience if they are brain related will be dependent on the location of the neurons that are impacted. So different parts of the brain have different functionalities, and if that particular part of the brain goes downhill due to the fact that the environment around it, the hormonal input, isn't as good, that's where we're going to tend to see those types of changes and those types of symptomatology. And this is why many of us use the term brain fog, but it can mean something different to each individual person. That's because based on our genetics, our history, different traumas that we've been through, it can affect different parts of the brain, leading to a different constellation of symptoms. One of the first parts of the brain that can be affected by low thyroid hormone is our frontal lobe. Our frontal lobe is one of the newer parts of the brain, and it's in charge of things like executive function, cognition, interaction with other people, and also our ability to plan and do things like figure out arithmetic problems. Now, just like we said before, if the job of the frontal lobe is to do those things, then we have to think about things in the opposite sense. If we can't do those, what sort of symptoms start to show up? And it typically includes things like this. People can become withdrawn from their family and friends and start to feel depressed. Or maybe some of the skills and tasks that they usually do at work and used to be quite simple for them are now much more difficult. Lastly, if you ever feel like there's a word that's right on the tip of your tongue but you just can't get it out, that's also related to our frontal lobe and the different functions that it covers. Next is our temporal lobe, and most people know the temporal lobe as being associated with memory. And while that's true, it also does a number of different functions, including things like the perception of sound and setting things like our circadian rhythm. So some of you may know someone who's getting a little bit older and is struggling with their memory, but they also have other symptoms like their sleep-wake cycle could be extremely disrupted, and they're maybe staying up throughout the night and sleeping during the day. So the reason why this is going on is because both of those functions, memory and sleep cycle, are impacted or regulated by our temporal lobe. So if those are the things that our temporal lobe are supposed to do, when they break down, we see, of course, issues with memory where maybe you're walking into a room and can't recall what you're trying to do, or you're driving down the road and are not sure where you're going or the route that you should take. In terms of sound perception, a lot of people will develop things like tinnitus. And tinnitus can be a high or low pitch ringing in the ear that can come and go or be constant throughout the day. Lastly, as we said, our circadian rhythms are really important to our temporal lobe and how those types of things work. And if our temporal lobe isn't functioning properly, our circadian rhythm can be thrown off and we may have difficulty falling asleep and or staying asleep and getting a restful night of sleep. Now real quick, did you realize that things like brain fog could be tied into thyroid function? And has your doctor explained these types of things to you before? If you didn't realize that, leave me a comment below and let me know if you've noticed that some of your brain symptoms seem to fluctuate in accordance with some of the traditional or classic thyroid symptoms, things like fatigue, weight gain, and joint pain. Now, the last part of our brain that can be commonly affected by changes in thyroid function is our vestibular system. Now, our vestibular system is something that I really enjoy learning about, but it can get a little complex, so let's just keep it simple. Essentially, our vestibular system is a collection of different parts of the brain, including our inner ear, our vestibular nuclei in our brainstem, and our cerebellum. When all three of these parts come together, it allows us to maintain balance by activating core muscles and controlling and stabilizing the way our eyes move. While this might sound a little trivial, it's really not. Most creatures on planet Earth do not walk on two legs, and to be able to do that, to be able to move our brain a long ways away from the ground and potentially putting it at more risk if we fall, is a bit of a complex task, and our vestibular system is heavily involved in it, which therefore makes it a big consumer of thyroid hormone. So if you're having problems with your vestibular system, some of the symptoms that you might notice are being more prone to things like vertigo or feeling dizzy and lightheaded. Maybe when you go from laying to sitting or sitting to standing, it takes you a few minutes to be able to stabilize yourself before you can start moving. And lastly, you might just feel kind of disconnected and not fluid with your body. Because our vestibular system is so important in stabilizing our core, if we don't do that first, then we can't have good interactions with the environment around us. But if there was two functional aspects of our lives that a lot of my patients will notice deficits in when they're having vestibular challenges, it's driving and also moving around in the dark. So when we have something that demands more of our vestibular system, and specifically that includes things like head movement, when we're driving our car and we have to do something like check to the left or right to be able to merge lanes or look behind us when we're backing up, that movement of the head requires good vestibular activation so our eyes can be stable with that head movement. But if that's not engaging properly, then when we go to do that, it can make us feel very unstable. And when we try to look back on the road in front of us, it can take us a couple minutes to be able to center ourselves and be able to get back on track. Now, when it comes to moving around in the dark, many people who have vestibular changes tend to rely more heavily on their vision to allow them to navigate their environment. But of course, if it is dark, we don't have as much of a visual input or stimulus to allow ourselves to balance. So when that happens, we become more reliant on the vestibular aspect, and if that isn't there to supply that, then it makes it very difficult for us. So let's say we're getting up in the middle of the night and we're trying to go to the bathroom. These kinds of situations require us to really make sure we have a handhold, we are quick to turn on the lights, because if we don't, we are much more likely to fall or trip. So to quickly recap and maybe remind you of the most important point of this video is that our brain is heavily reliant on good thyroid function. And the reason for that is because our brain has a very active metabolism and it needs thyroid hormone to allow it to go. Now, depending on what part of the brain is being affected in terms of those changes in thyroid hormone, we can see brain fog show up in a number of different ways. If it affects our frontal lobe, we'll see changes in cognition, focus, executive function, and our ability to interact with those around us. If it affects our temporal lobe, we might see changes in memory, in things like sound perception, and our circadian rhythms. And lastly, if it's affecting our vestibular system, which includes our inner ear, our vestibular nuclei in our brainstem, and our cerebellum, we may have issues with vertigo, dizziness, and a feeling of disconnectedness from the rest of our body. Now, if you want to continue your learning or you need some additional help on your health journey, there's two ways to do that. Either you can contact me at contact@seattlethyroidhelp.com and see if you qualify to work with me one-on-one. If you don't want to do that, you can always download my free guide, which is 109 foods to boost your thyroid and support your energy, and you can grab that at the link in the description box below. Otherwise, that's all I have for you guys today. Thank you so much as always for hanging with me. I hope you know how incredible I think you all are, because it's true, I do. And I think it's great that you're taking extra time to invest in your health. Otherwise, make sure you check out my most recent video if you haven't done so already. Give this video a thumbs up, subscribe, leave a comment if you have any questions. As always, I hope you're having an absolutely incredible day. My name is Dr. Brad Bodle, and I will see you all next week.